Interesting medical facts, part 32. With certain blood cancers, we can give chemotherapy for a few cycles, get lucky, and you're cured forever. If you have a higher risk blood cancer, occasionally what needs to happen is you go through something called bone marrow transplant. This is when you take someone else's stem cells, use very heavy duty chemotherapy to essentially wipe out your cells, and then use that other person's stem cells to then seed your body so that hopefully the healthy cells that you got from the donor are what start to grow, and you essentially have a new blood system. And you really want to do your best in matching people's blood types, because if you don't, something called graft versus host disease happens, where the graft, the donor, attacks your body, the host, because it recognizes it as foreign. The immune system is off, something's weird, so then you get a whole bunch of symptoms affecting lungs, liver, skin, and so on. So we usually try our best to make sure that the donor is related to you, because you're more likely to have a similar blood type. Usually, men are preferred over women because women have been pregnant at some point in their life, and they might have had antibodies to the embryo, so their blood actually becomes a little bit more complicated to use. You also prefer to have a younger donor over an older donor because younger people have less problems with their blood. Caucasian patients have a higher chance of finding a donor because even if they don't have a relative that's going to donate to them, European countries have a very extensive bone marrow donation registry. That's why if your genetics are non-European, it's crucial for you to be on this bone marrow donation registry, because you could be helping out someone that absolutely needs it.